politicians, and perspectives. The program with a plethora of guests on some days, and maybe one or two short on another day.
On others.
Picking with the chickens and whatever the other expression is. Probably better clean it up a little bit and keep on going here. Mrs. Busby.
Yes.
You have a kudo that you'd like to give.
Yeah, I do.
And I certainly endorse that. Whether it make any difference or not.
In the alley behind my house, which is a pretty busy place, it had such huge holes in it, and at one point it had been blacktopped, so the holes were edged by this sharp blacktop, and it was like driving down a minefield, and it'd been going on for quite a long time. I called uptown, and the nice lady answered, and I explained the situation.
Nice lady was in the City Hall office.
Huh?
You did good service out of that City Hall office.
Oh, gosh, yes. The nice lady who answered, I explained the problem. I said, somebody's going to be going down that alley one of these days and blow a tire. And I said, with my luck, I'm thinking it's me. So anyway, by golly, they came out, and they were just nicest fellas, and they fixed the alley. And I just want to say thank you very much. I just would like to venture a guess here that they get chewed out probably more often than they get thanked. Well, there's a big thanks from me.
Yeah.
And that's all I have to say. The program's yours.
So, guess you can get in the car and go home. All right. So, we're happy to have this young lady we have with us this morning. Because she added to the plethora of guests that we had. I'm going to let Mrs. Busby introduce this nice young lady because she's giving of her time to come and talk to us about an important matter, or matters, plural. Go right ahead, Mrs. Busby.
Yes, Kara Davis is the Director of Nursing at the Logan County Department of Public Health. And
works for the nice
there's
man.
An awful lot. That's another outfit. You probably don't get thanked as often as you get
No, we don't.
That goes with the territory.
All the work that you do. I had called you because I was interested in all the play that the vaccination business is getting because of this measles outbreak that we've had. And I'm sure there are reasons. I guess I'm kind of a follower. They say you should have your kids vaccinated for this and that at this age and that age, and I always hopped right up there and got it all done. But some people don't do that, and it's not always because they just overlook it. It's because they don't believe in it for one reason or another. And I thought, Kara, it would be so good if you could help us by explaining to us this whole vaccination business. Like measles has probably been around since before I've been around, I know. And here it is, rampant. And I'm glad you could come. You're a nice lady, and thank you.
And patient.
Well, thanks for having me.
Tell us a little bit about what's the downside that people look at when they decide not to get their kids vaccinated?
Well, in the last, I would say, probably 20 years, there have been studies done where people think that vaccines cause autism. Autism has definitely been on the rise, but so have births. So in 1997, there was a physician who did a study, and he actually falsified the results that said that the MMR vaccine, which is the measles, mumps, and rubella vaccine, caused autism. So a lot of people picked up on that and said, my child has autism because they received the measles, mumps, and rubella vaccine. Mm-hmm. Now, that vaccine is first given when the child turns 12 months of age. And autism seems to show its ugly head around 15 months, 18 months. So parents correlated that vaccine to the diagnosis of autism. Since then, it has been disproven that that is not true.
But they didn't get that message.
That message didn't go out.
You know, I'm not sure. I don't have an autistic child, nor do I have a lot of experience with them. So I can't say, as a parent, how I would feel if that happened to my child. Now, as a nurse, I think that I would rather have an autistic patient than a child with measles or dead, per se, from one of the diseases that it could cause. The vaccine, not having the vaccine could cause. And I know that I follow some blogs on Facebook, and a lot of the parents have said the same thing. I'd rather have my autistic child than a child that's no longer with me. So,
You know, anybody that pays any credence and they want to read on Facebook, they're pretty desperate. Facebook is a fun thing. It's to be taken for what it is. People put stuff out there, and the first thing you know, somebody read it. I read that in Facebook, and I know it's so. Well, that's bull.
it's very opinionated, that's for sure.
You know,
the certain blog I follow is very pro-vaccine, so I kind of just read the comments just because I am very pro-vaccine myself.
Well, of course you are.
Even before this job, I was pro-vaccine, so.
well, I think, yeah.
Well, I was never a nurse, and I was always pro-vaccine. Why put your kid through something, and in many cases, not many cases, in a few cases, put yourself through something I can't imagine, just because you heard a rumor that
Right.
that this might be the case.
Right.
So that makes no sense at all.
No, and a lot of the children that are getting the measles are children who cannot be vaccinated for one reason or another because of age. You know, the first time you're vaccinated is 12 months, or because you have a medical condition that you can't be vaccinated with a live vaccine because it is a live vaccine. For example, I have a friend who has a child who has a heart defect, and she cannot receive the live vaccines at this time. Hopefully, sometime in the future, she will be able to, but because she's immunocompromised, she can't have this vaccine, and if she would get measles, I mean, she could die.
Yeah.
And
Oh, my.
they've been through so much with her cardiac issues. I would just be devastated if that happened because someone chose not to be vaccinated.
You know, that's just a side comment on that. That's living with a sentence every day in your life with a child like
Yeah.
that. You know,
She's
that's
super sweet, too.
That's a daily worry. My goodness.
It's a daily worry when you have healthy children, though, too. So.
Well, I suppose that's true too. Yeah.
If you're issued the active kind, it can be a daily
Yes,
worry.
yes.
I know my mother worried daily about me, and with good cause. But
Now, how are the measles transferred from person to person? Is it just the breathing?
Yes, they are airborne, and they do live a significant amount of time on surfaces. I'm not sure of the exact time, but it is a significant amount. So, for example, say you suspect maybe your child has something going on with them, and you take them to the doctor, and they're in the doctor waiting room, and they find out that they're diagnosed with measles. In the meantime,
Oh.
20 other people
room's full of it. Yeah.
are in the waiting room
Sure.
and are now exposed.
Yeah.
That's kind of where all of this has started. Is I know in Illinois the cases up north where the children traveled overseas, and when they came back, they were in school, they were in the airport, they were in the airplane.
Yeah.
It's
Yeah.
and ERs, and it's spreading. And unfortunately, it's up 300% this year than it was the
Really?
same time last year.
Why this year over and above last year and the year before?
I think they're still trying to figure that out. I think there's 650 cases right now in the United States, which is a significant amount, more than we've had in the last 20, 30 years.
When was this vaccine introduced? Do you have any idea?
No, I am not exactly sure. I'm thinking in the 70s, but I am not exact. Don't quote me on that. I'm not sure. I know that I didn't receive it. I actually found my vaccination record the other day when I was looking for something else, and I received it 3 times, but I didn't get them until the 90s. All 3 of them were given to me in the 90s, and I was born in the late 70s. So maybe it wasn't until the 80s. I'm not sure. I'd have to look that up.
Gosh, I was thinking my kids had it, and they'd be older than you.
Yeah, I'm not sure. I'd have to look it up.
What is the direct result of measles with not being treated? What happens to your child, your patient?
I'd have to look up the symptoms and the long-term effects of that. But I know there are long-term effects.
Pretty serious stuff.
Yeah.
Yeah.
I mean, obviously, if they developed a vaccine, it can be good.
They were working on it a long time ago, at any rate. Yeah. Oofta.
Well, Nursey, in the old days, nobody likes to hear an old man talk like this, but anyway, in the old days, when you had a communicable disease, a man showed up at your house with a little hammer and a little tack and a sign that says,
yes,
measles or mumps or whooping cough or whatever, and your house was quarantined.
That's right.
And I know my dad had to move out several times because he couldn't go to work and live in that house. So.
Right.
Well, these diseases have been around for a long, long time. And what would you say to a mother who told you, no, I don't want my child vaccinated for like Bill says, the measles, the mumps, all the things.
Whooping cough, all that stuff.
Yes.
Well, to go to school, those are things they have to be vaccinated for unless they have a religious exemption or a note signed by a doctor. A lot of the doctors are not signing those, and it has to be, if it's signed by their their priest or their minister, it has to be followed up with a physician before the school will let you in.
Okay.
So I make sure I tell them, you really need to take this into consideration. They won't be able to go to school. And then I say you need to go to the CDC's website, do some more research, and use that website. That is the one that has the most accurate information. Don't just Google vaccines or immunizations. Go to the CDC's website. That one is super important. I actually haven't encountered in my, knock on wood, my 5 years of working public health of parents who don't want to do the required vaccines. Now, there are a few, once the kiddos get older, the HPV, the meningitis B, that they don't want to do. I do usually ask them, why don't you want to do those? And they we talk about it. I do tell them to rethink that. And the kids are always in the room too, so that's kind of nice because they're listening as well. So, and I know a lot of kids, once they turn 18 and they can make that decision for themselves, sometimes they come back and they get the HPV vaccine. But for the most part, for the vaccines that are required, I have not run into any people who won't vaccinate their kids.
Well, maybe somehow the message has gotten out.
I hope so.
That the trade-off's not good.
Yeah.
Tara, how long have you been an RN?
Oh my gosh, 2001. I graduated in 2001 from St. John's College in Springfield. So a long time. Almost 18 years.
Yeah, it's hard to believe.
It is hard to believe.
Have you served in the capacity of a floor nurse?
Yes, I worked at St. John's for 14 years before taking this position.
You had considerable experience there then.
Yes, I did lots of different jobs there. I worked orthopedics, post-surgical. I worked briefly in a dermatologist's office. And then I decided to go into public health, which I had forgotten how much I liked public health from nursing school. And I really do like public health.
What is it that you find so intriguing?
I grew up in Logan County. I now still live in Logan County. My husband grew up in Logan County, has a business here in Logan County. My kids, I have 3 children.
What's the name of that business?
What?
We give you a free commercial here. What was the name of the business?
Davis Brothers Incorporated is a trucking business in Elkhart.
Elkhart.
That's his business,
Right,
yeah. So if you need anything hauled, just give him a call.
Okay, I'll write that down.
Wheelbarrow to a semi.
But public health is just, I just feel like you're just helping the entire public. And with Logan County being so small and it's just so quaint, and I just feel like everything I do is making things better for my family, my children in the future. vaccinating. Make sure your kids are vaccinated. Make sure adults are vaccinated. I work on the opioid task force through the hospital. I do a lot with that. We do a lot of STD testing and getting the word out about STDs and HIV. And I don't know, I just feel like I'm doing more than just working with one person. I feel like I'm working with an entire community, entire population. So.
Well, apparently, from what we hear on the news, being on the opioid task force, it could well be a big part of your job. It's a growth industry.
Yes, it's not a huge part of my job, but I really enjoy it.
Yeah.
I really like harm reduction, which would be, making sure that people don't get diseases from using dirty needles, or the Narcan, the naloxone, making sure that they have that in their possession, or their friends and family have the naloxone in their possession if something does happen. And that's for people who just would take pain medicine on a regular basis and maybe take too much pain medicine.
I was told the other day, and was unaware, that if you were prescribed one of these medicines and you were through with it, you weren't supposed to flush it down the toilet.
That is correct. You're not supposed to throw any medication in the garbage or flush it down the toilet. It could get into the water supply. The health department is a drug disposal where you can bring your medications, no liquids or sharps. And then also the Lincoln Police Department has a mailbox out in front where you can put your unused and expired medication in there as well. No liquids or sharps.
Okay.
So,
That's
and
a service.
Saturday.
That's a community service.
And the Saturday is the DEA Drug Take Back Day, and the police department and the hospital are partnering to do drug take back. So you can
This Saturday?
This Saturday. Mm-hmm. If you're unable to get out of your house, you can call dispatch, and they will send an officer to your house to pick up your unused or expired medications.
Oh, if the neighbors saw a policeman coming to my house,
well, then you can just take it yourself or bring it to us.
There's a good service somebody could offer, Judy.
Yeah, I had some surgery and was prescribed. I can't remember what the name of it was, and I didn't take any.
It was Gaga. The name of it was Gaga.
Laga. I didn't take any because I thought, well, how do I know what my level is before I become addicted to something? I don't want to get involved in that.
So she toughed it out. Judy and I both, I know I'm speaking for Judy, we've had Don Cavey and other representatives of the Logan County Health Department. We're lucky to have that department here on 3rd Street there. And I don't think a lot of people know enough about it to take advantage of it being there. It covers a lot of, for the want of a better word, sins. It covers a lot of territory of service to people. And not the least of which, by the way, is vaccinations which they give you, flu in particular.
Right.
Boy, that's duck soup. You go in there and you put your name down and you're out of there in 3 or 4 minutes. And who wouldn't take advantage of that?
Yes, we have no appointments. We usually try very hard to get people when they walk in seen very quickly.
And you do.
During October of last year, we did quite a few flu clinics around the county. This coming October, we're going to try to up that. We went to Mount Pulaski, we went to Emden, we went to Chestnut, Latham, quite a few here in Lincoln, quite a few in Lincoln. We're going to try to hit Atlanta, Elkhart this following October, this coming October.
You're like traveling salesmen.
We are. We're trying to get people so it's more convenient for them to get vaccinated. And I actually feel like we gave more vaccinations this year to people. I don't know if it was because of Kroger closing and people had went there and now they're coming to us, along with Stacy's Pharmacy closing and now they're coming to us. I'm not sure, but we're very appreciative of the business. We have vaccines for people from birth to until they're no longer with us. We have every vaccine available. We have typhoid if you're going to be leaving the country and you need that vaccine. That is a pre-order, but we do have it. We can get it for you.
But now you say if you're leaving the country, you need that.
Not
Is that
necessarily.
by law?
It all depends on what country you're going to.
Oh, I see.
We do have a travel clinic. You would call and talk to Mary Anderson, and she will fix you up with, you tell her when you're going to be gone, what country you're going to, and she'll fix you up with what you need for that country, where the embassy is, what to be aware of, and all things like that. So it's a very good service, and it is completely free of charge.
Covered like we try to cover for our sponsors. We work real hard up here at WLCN 96.3, and we're going to bring our sponsors on right now, and then we're going to talk about the vaccination you have for Beeston, Burton, and Broadwell. Go right ahead, Jim. Right back live in the studios here. This is Viewpoint. Our guest today is Kara Davis, one of the great stellar representatives of the folks over there at the health department over on 3rd Street, the end of the confluence of 3rd and Union and Sangamon, whatever it all comes together there. In any event, they're doing a great job for us. It's your health department, and they're serving you and your family, and they just do a multitude of great things over there. Happy to have you with us this morning, young lady, and thank you for taking the time off. Yeah, I remember I had to ask that young lady what her maiden name was. You know, to get to be my age, you putting there no anybody that's could walk through the county line. So we did in fact know this young lady's family, and it's nice to have us with her. And it's nice to see these young folks that our county residents go away and get their their professional and formal education, and come back and serve their county. This is exactly what this young lady is doing at our Logan County Health Department. So we thank you for being with us, young lady.
Thank you.
Go ahead, Mrs. Busby.
Another thing that kind of intrigued me was your dental services that are done in conjunction with SIU, School of Medicine. But you say that you had dental services for children prior to hooking up with SIU.
Yes, the dental clinic was ours at the health department, and 2 years ago, SIU took them over along with opening up their FQHC, which is their
what?
Their doctor's office. It's federally qualified healthcare system. So they have a physician and a physician's assistant there with SIU that they are taking patients, and then they also took over the dental clinic. They have a dentist and a hygienist and some dental assistants. They see primarily Medicaid children. They do also see veterans. You'd have to call to ask exactly, the qualifications to be seen there, because I'm not sure anymore since we don't have it. But I do see lots of kiddos in there. So,
there was a time when people thought, well, they didn't have to worry about the kids' teeth when the kids were kids, because they had kids' teeth and they'd be gone anyway. But that's not true.
That's not true, no. They like to start seeing the kids as soon as they have teeth pop through, and then every 6 months is when kids need to be seen, and they have to go to the dentist before they go into kindergarten and 2nd grade. That is a requirement. So
is that right?
It is for school, yes.
Now, that's not been forever. I don't think.
I don't think so. I know that I have a 3rd grader, and it was required for her, but I'm not sure before that. I'm not sure.
Well, that's interesting. Apparently, somebody in their infinite wisdom thought that if the child was having an awful time with their first teeth, they're liable to be having trouble with the second teeth if they don't get a handle on it.
Absolutely.
So thank you, God, for that.
Yeah. We're lucky to have that dental clinic in the county. Very lucky.
Yes. So what are the requirements? It's for children, right?
Well, no, they see adults and veterans as well, but I'm not sure what their requirements are. You'd have to call the health department's phone number and ask for SIU, or there's a button to push for SIU and speak with them directly.
Very good. Do most of your services require that people have an appointment?
No, the only services that we have at the health department that require an appointment are STD testing and counseling. We ask that you call, make an appointment for that. We only have 2 nurses that perform those, and we need to make sure that they're available for that. And just to plug our STD clinic, our STD counseling and testing are completely free of charge to anyone. So anyone can come and have STD testing, and it is completely free.
Now, explain to this old man, STE.
Sexually transmitted diseases.
Oh, hello.
You had to ask.
Oh, well, see, I'm sorry. The
Been around forever.
So long. Yes, come to think of it, it has been around forever.
Yes, and we test for gonorrhea, chlamydia, syphilis, HIV, and hepatitis C. So we test for a plethora of things. So
Yes, you do.
yes.
If anybody'd go to the basic training and go through those movies, they sure wouldn't have to worry about that anymore. Scared the daylights out of all of us.
For any of these STDs?
There are not vaccines, no, but there are treatment.
There are treatments, but no.
No vaccines, no.
Thank goodness.
Is anybody
You know.
working on that?
I'm not sure about that.
They're
I'm
on
not
to
sure.
Center for Disease
Well, give
Control.
me a call.
Why don't you call down there to Georgia and you
Yeah.
see the Center for Disease Control? You might
is
find
that
out.
becoming more widespread?
Yes.
Oh God, yes,
Yeah.
yes.
Yeah.
You listen-
Unfortunately. it
Kind of
is.
like measles. There's a whole plethora of it.
Yeah, that's a whole nother topic, though.
Yeah, it is.
Well, that's stupid. But I'd ask what STE is. You know, it's just STD.
Well, acronyms keep evolving.
It does.
So you mustn't
Well,
feel
that
bad.
shows you what
Oh
book
my
I-
gosh, when I started public health, there were so many acronyms. It took me
Yeah.
3 years to figure them all out.
Yeah.
I bet you can get a master's in
Oh my
acronyms.
gosh, it's ridiculous, public health, how many acronyms there are. I still have to ask what some of them mean.
Yeah.
Yeah, you've been there a while too.
I have been there a while.
It never. It's just something out of mind. You know, it never occurs to old folks like that. That's still around, and and in a big way,
Yeah.
which is a bad part of it. Yeah.
And the bad part about it is the gonorrhea is becoming resistant to the antibiotics that they have to treat
Is that
it.
a fact?
Yeah. So that's very scary.
So they'll have to figure out a new
They're trying.
vaccine.
I'm sure they're trying to figure
Oh,
out
sure.
a treatment for it. Yes.
Is that an ever-present problem that vaccines can have a lifespan?
Not vaccines. Well, like antibiotics. People start to become resistant to antibiotics.
Yeah. That's
Okay.
Just because you get it so much, or just the condition, the disease evolves.
Well, that would put you in a real pickle, wouldn't
Yeah.
it?
Yeah.
What if you needed this medicine for whatever the disease was, and you come to resist it?
Yeah.
What do you do? Just try something else?
That's
Yes,
called
they try
tough
something
luck.
else. Yes.
Yeah. That's
Yeah,
cause
it's scary.
That's cause pay attention. That's what that's called.
Yeah.
Yeah.
It's scary.
The fact that comes under the guise of social medicine never occurred to most of us. So we're working out there, going out and getting a morning Coke somewhere. You know, it's out of mind, out of sight,
Yeah.
out of mind. So that's the way it is. Tell me about your workload out there.
Yeah.
You have a daily workload of how many patients approximately?
We're slow January, February, and March.
That's a good thing.
January, February, March are kind of slow when it comes to the immunization clinic. Not many people coming in. Flu shots are kind of wrapped up. No one's thinking about the next school year. April, May start to pick up a little bit with the back to school shots. June, July, August, September are extremely busy with back to
Yes.
school shots.
Right.
It really depends on, what's going on
Yeah.
in the county with, back to school or flu. We start getting our flu shots in September. We're still doing back to school shots. So September and October are quite busy.
Busy time.
Busy times, yes.
Now, does Mr. Cabby have a pretty good budget to juggle with and work with all the time? I'm sure it's really difficult to come up with the figures that fill the need.
You know, it is. Unfortunately, public health is not financed as well as it should be. Unfortunately, we really depend on the community using our services. It's very important to know that the people who live in Logan County pay taxes to the health department, keep the health department open. So instead of going to a big chain store or a pharmacy to get your vaccinations, we would really appreciate it if you would use us.
Well,
I'm not sure people realize that's available.
Before I started here, I did not either. I was not aware. So
are you paid on a reimbursement basis?
We take insurance for our vaccinations. So people who have private insurance can come and receive their vaccines at our facility. We do take all major insurances, and then obviously we take any of the Medicaid plans as well. So it's really important that people, use our facility. My 2 older children would always get their vaccines at the doctor's office because we were there.
Sure.
I had the third, and I worked at the health department, and all of her vaccines come from the health department. And now the older ones do as well, but they only need flu shots. So, but my kids, all of their things are done there.
Well, it's a wonderful service, and sometimes I think it's not known about as widely as it should be because you offer so many things.
Yes. On top of the immunization and the STD clinics, we also have WIC, which is Women, Infant, and Children. There are qualifications that you have to meet to be part of WIC and their financial requirements. The numbers change yearly, so to know if you do qualify, you'd have to give the health department a call and talk to the WIC department or stop in to see if you qualify for that.
Now, WIC helps with formulas and so forth. What all are the services that WIC provides?
They help
to whom?
Well, they help with pregnant moms and then children up to age 5. So once the child turns 5, they no longer qualify for WIC. They also have something that is amazing to me, is having the Abraham Lincoln Hospital Market here in town.
Yes.
We do farmers market coupons for WIC. So if you're on WIC, you qualify for the farmers market coupons.
Really?
And you can use those at the market. And I just love our market. I wish I qualified for WIC, but I don't.
Yeah, it's really a neat thing.
I love it. I love going there, and it'd be nice to have a voucher.
Yeah.
But people don't take advantage of it that are on the WIC program.
Now, WIC is an acronym for
Women, Infant, and Children. So it's pregnant women, infants, and children up to age 5. They provide formula. They provide certain foods. Not all your formula and not all the food that you would need for your family or your child. And it's based on your income. So I'm not sure of the income requirements. You'd have to call and talk to them. It's based on how many people live in your household. So if you have 4 people living in your household, you'd have to have a certain income. I'm not sure what that is off the top of my head. It's changed. It changes. So, but we have 2 nurses, and we have a breastfeeding peer counselor and a clerk who's the same person, and they are all absolutely wonderful, very informative. They've all the 2 nurses have been in the clinic, have been there forever. Dana is the supervisor, and she has worked there, I don't even know, longer than anyone at the health department. So she knows her women, infant, and children.
Dana Oltmans.
I think she was there when I was on the board, and that was about 80 years ago.
I don't think she's been there that long. She's not that old.
So therefore, Judy, the moral of this morning is don't ask Jim for a raise.
And have a baby. Something new that we also have gotten at the health department is we are a milk depot now for breast milk.
You're a what?
It's called,
technically,
right?
Technically, how does that work?
Okay, so tomorrow we actually have an open house from 1 to 2 to answer any questions, show you our freezer. So basically, there's a company in Northern Illinois, and they have a freezer in our facility. So say you're a mom who has an abundant supply of breast milk and you can't use it for your child because it's so much that you want to donate it to help other babies. So you would call the business, they would call your physician, the child's physician, and do some testing on you to make sure that your milk is safe. You then are said, yes, you can donate. You're going to bring your milk into the health department. We store it in the freezer until our freezer is 75% full. Then we send it back to the facility. They test it, pasteurize it, package it, and sell it to NICUs, neonatal intensive care units across Illinois and Wisconsin, for babies who may not have access to breast milk from their mom. So it's a great thing
That's
to have.
remarkable.
So.
Well, aren't there some physical anomalies that the child almost has to have that as opposed to formula?
Some, yes, some. And preemie babies are number one. Preemie babies need the breast milk. It has so many more nutrients and proteins in it than formula has. So, we're really wanting people to come in to learn more about it tomorrow from 1 to 2.
Yeah.
We're
People out
excited.
there don't know of that program.
We're very excited. We just got it the last couple of weeks. The freezer just came in, and we have one person who has been qualified to donate. So she's going to be donating. So we're really excited.
Good for you. I have, before our time runs out here, I'd like to ask you a question that's probably none of my business. I've been told that several times in my life.
Especially by your kids.
Anyway, yes. Anyway, nursing homes are closing because Medicaid doesn't pay their bills to them. Now, you take a lot of Medicaid patients.
Correct.
How are you being affected by the fact that they don't pay their bills?
Or are you aware of that?
It's not so much Medicaid, it's the state in general, unfortunately. They are very behind in their payments.
Well, I'm so sorry, but they have bigger fish to fry. They want to take in tax money. They don't really give a toot whether you get yours or not.
Well, I don't know if that's completely true, but...
Well, I'm a little jaundiced. I'm sorry.
We'll see how things change with the new governor. We'll see. With being the budget impasse with the past governor, they couldn't send any money out, so that wasn't the comptroller's fault. So we'll see how it goes this year. It's too early to tell.
Yes, it is.
Yeah.
We're just barely into it, but it's, if you don't pay your bills, whoever you are, whether you're me or the state of Illinois, other people get screwed up.
Yes, unfortunately it is.
Talking about the government not paying their bills, that's kind of above my pay grade, isn't it?
Yeah.
I don't think I'm qualified to comment, except any comments I have would be pretty jaundiced. Not to be confused with a medical term.
Well, give us your phone number, and people can call if they have any questions about any of these programs that you offer, and they are myriad. Do you have any kind of a leaflet so that if people are going by, they could get that?
Absolutely. Yes, we do. And our phone number is 217-735-2317. Press 0 to talk to the operator, and she can direct you where you need to go.
Right. It's a wonderful service that you perform, and you manage to keep plenty busy there, don't you?
Yes, we do.
How many people do you have on staff?
21, I think. Now we're down to 21.
Well, you must...
We do have a job opening for an RN or a social worker in our Health Works department, which is the medical case management for DCFS. This is a Monday through Friday job, 8 to 4:30. So if there's any RNs or social workers out there that want a job change, we are accepting applicants for that.
Well, and from what I've heard over the years, the Logan County Department of Public Health is a heck of a good place to work.
I do enjoy it, yes.
Yes.
I do.
Well, we've always found them very cooperative when we've asked if they'd like to have a guest on to tell us about anything new, and we appreciate that. And more importantly, I think our listeners appreciate the fact that people from the Logan County Health Department will take time to come and talk to us about what's going on there. For instance, my eyes kind of opened wide when I heard about availability of mother's milk being in its natural form being available. That's remarkable to me.
Yes. Now, we don't have it to give out. We just are the storage place.
You're the collector.
We're the collectors, yes.
Yeah.
So, and that's very exciting. Very exciting to do. I mean,
Well, you could participate in this and end up saving some preemie's life.
Exactly.
You know?
Yes.
Now,
And
this
the
is a-
Women, Infant, and Children's program is very pro breastfeeding. I mean, obviously, if you don't want to breastfeed, we're not going to push it.
Sure.
I mean, we want your baby to be fed. So we want your baby to be
whatever.
healthy.
Right.
But breastfeeding, we feel, is the way to go. But if that's not what you want to do, we're not going to shame you for it. But so having the milk depot there is just...
But it's natural.
Well, you
Yeah.
almost have to want to for one reason or another in order to be successful, don't you?
Yes, and it is hard. It's hard. Those first couple weeks are very difficult for a new mom.
Oh, yeah.
And breastfeeding. It's just so much easier to go and grab a bottle. Coming from a mom of 3.
Cara Davis, we
Thank
appreciate
goodness for even flow.
Yes.
We appreciate you taking your time to come up and visit with us this morning. I know you've got more important things to do, but you're letting our listeners know the extra things that are available at our Logan County Health Department, and that's important. Judy and I, as I said before, not alluded to, have commented directly about it. We have a very high regard for what goes on out there at the end of 3rd Street. Well, at the beginning of 3rd Street, actually. So we thank you very much for being with us.
Well, thanks for having me.
We always try to close with a quote, and very frankly, I don't have anything but a generic quote this morning because I didn't take time to look up anything. It would be germane, but I can quote with this quote: "Be the reason somebody smiled today." Thank you very much, Cara Davis.
Thank you.